thanks so much for joining Making Healthcare Work for You, Different Perspectives and Empowering Solutions. I'm Stephanie Fields, joined by my co-host, Dr. Apoorv Gupta, and today we're welcomed by Dr. Payal Bhandari, who is the founder of SF Advanced Health. And we had an amazing conversation with you. We were so excited to be able to hear all of the ways that you're helping patients and also living a life that physicians probably dream of, where they're able to help patients in a different way and be outside of the insurance system where you're kind of handcuffed to some of the interventions and procedures. So for you, you're able to take these situations. You gave us an amazing story about a woman with AFib and how you helped her get off of her medications and look at it from a more holistic perspective. And Apoorv had an additional question from the patient's idea. So Apoorv, take it away.
Yeah, thank you, Stephanie. I think you recapped it so well. And honestly, Payal, everything you said is just so deep and so profound. And clearly, you've thought it through at an incredibly deep level. So in a very tactical sort of sense, Stephanie and I were also wondering, how did that patient with AFib find you? How did she even know that you were out there and that she should be looking? And then along those lines, how are other people who are maybe in a similar mind, how are they going to find you? Because all of the patients are essentially being driven by their insurance plan to find a provider who participates in their insurance. So it's a little bit of a chicken and egg situation of how to break out of. But I'd love to get your thoughts on the patient's side of it and how they access you.
Most of these people are finding me online because I have been writing for so long, where I've been posting blogs every week to every month. It's by one, being a thought leader and believing strongly on growing a practice organically versus just paid ads. And what people are doing is that they're Googling like integrative or functional medicine. I'm one of the top physicians that comes up. And so they end up like seeing my name. But I think the other thing is that research today is what you find online. And so there is a lot of videos that I've posted to articles. And so what happens is they end up like being able to interview me before they actually even meet me. And it's that I meet what they're looking for. And the other thing is that there are a lot of testimonials that are basically 5-star testimonials. And so they have the validation of what other people's experience are telling them. They have information that they're accessing from online. And based on all that, that is how they're finding me. And a part of it is also I've been a medical advisor for other prominent companies that they're also finding me through that, where they'll say, you know, like I'm the senior medical advisor for Eucora, which is the only product out there for prevention of UTIs. And UTIs is a huge problem for women, a little bit less than for men. And so it's really organically that the practice has grown.
Excellent. From a patient perspective, it almost seems like it's like you're probably getting people from a place of desperation who may be at their wits' end after getting these diagnoses or put on yet another medication that's not making an impact in their condition. So it seems like that's what's leading to them. Because if they're going on and Googling, like Apoorv said, you know, people traditionally, you're finding a provider by going on your medical insurance and saying, okay, who's in network? But to get to you, it must be the next step. They've done that. They've been there. They're done with it, and they want something that's actually going to help. And so then that's where you come in. So it's interesting because it's even more of a testament to the work that you're doing and the outcomes that you're having, because you're probably getting people who are in that situation that they've been through the ringer of the traditional healthcare system.
Yes, I am the last stop. So people don't come to me as the first. I am like, that's exactly it. They've seen a lot of specialists. They have done all this research and they are in trouble.
Wow.
And again, I basically am great for anybody until their point where they're at the end, you know. So that's not my role, but I will meet people where they are. If they're in stage 3 pathology, I can work with that. If you're in stage 4 and 5, where you really are close to hospitalization, then I will be supportive, but I can't be the person that, you know, you're exclusively coming to. And I am a consultant at this point. I'm not a primary care physician that's just taking a person on. I serve a very critical piece to help people understand all the different pieces that they're trying to manage. And I help put all these pieces together and really dial in exactly to what is happening to this human being and what isn't working. And saying, okay, we're going to focus on just precisely this is it on a cellular level. So that's why people come to me, because even they will have their own primary care doctors and they have their own specialists. But like, we need that one person who can put it all together and drive to results.
Remarkable. And then just as a quick question, so people can come to you though, if before they get to that point, if they want to avoid going.
Oh, always. I mean, that would be the best, because you're going to save yourself a lot of hassle and time and money. So yeah, I mean, people come to me from all over the country and the world because I have a virtual practice at this point. And in that 90 minutes with me, we go right to where the issue is. And so they're able to understand their issue. They're getting educated on it. They know what they're focusing in on. And they always have the opportunity to check back in, right? And the key is that I'm not there leaving them hanging. I said, it's the patient who drives what they want. And I am the guide to help them on the journey.
Awesome. Thank you so much for sharing that. It was amazing.
Truly fantastic. Thank you, Payal.
Definitely.
We'll talk to you soon. Bye-bye.
Bye.